Silent killers, 10 diseases that sneak up on your dog. Let's protect them together. Take a look at your dog. Right now, they might be curled up at your feet or waiting patiently by the door for their next walk. You see them eating their dinner with gusto, playing with their favorite toy, wagging their tail so hard their whole body wiggles with joy. From the outside, everything seems perfectly normal. It's a picture of health and happiness, a daily rhythm that brings us comfort and reassurance. We see what we want to see, a happy companion, living their best life. But what if that picture isn't complete? What if, beneath that familiar furry surface, a deadly disease was already developing, silently and without any obvious warning signs? This is a terrifying thought for any dog owner, because our dogs are masters of hiding discomfort. It's a survival instinct inherited from their wild ancestors, where showing weakness could make them a target. Because of this, many of the most serious canine illnesses begin with tiny, almost imperceptible changes. Changes that we, as loving owners, might easily mistake for something else entirely. We might write them off as just a normal part of aging. Or we might assume our best friend is just feeling a little tired today. Or perhaps they're simply having an off day. We've all been there. We tell ourselves it's nothing, that they'll be back to their old selves tomorrow. Unfortunately, with certain diseases, tomorrow might be too late. Some of the world's most dangerous and life-threatening conditions for dogs are also the most deceptive. They don't announce their arrival with dramatic symptoms. They don't appear dangerous or urgent in their early stages. Instead, they quietly progress, doing damage internally until they become advanced, and the treatment options become far more limited, more expensive, and less likely to succeed. By the time the signs are impossible to ignore, the disease may have already won. But it doesn't have to be that way. Today, with the help of veterinarian Dr. Elie, we are going to arm you with the knowledge you need to become your dog's first and best line of defense. We will count down 10 of these silent killers that every single dog owner should be able to recognize. For each disease, we won't just tell you what it is. We will break down the subtle early signs that are so often missed. We'll give you a clear guide on when to worry and transition from observation to action. And most importantly, we'll outline the immediate next steps you should take to get your dog the help they need, fast. This isn't about creating fear. It's about empowerment. The information in this video is designed to sharpen your instincts and deepen the connection you share with your companion. Knowing these warning signs and understanding what they mean could one day make all the difference. It could be the key that helps you save your dog's life. Let's begin. Why dogs hide illness. Instincts mask discomfort and pain. Subtle changes matter. Watch calm behavior shifts closely. Senior dogs rest more. Don't ignore new fatigue. Family touch reveals flinching, tenderness, or withdrawal. Slow walking, stiffness, or hesitance can flag issues. Loss of appetite or lying down after meals needs attention. Closing, trust your gut. Small signs matter. Bad breath isn't always just bad breath. That odor you might be dismissing as normal dog breath is often the very first sign of a serious, progressive, and painful condition lurking just beneath the gums. Dental disease. It's the most common clinical condition affecting adult dogs, yet it's one of the most undertreated. Today we're going to change that. We'll break down what it is, who's at risk, and most importantly, what you can do about it, starting right now. So, what exactly is dental disease? It all begins with plaque, a soft, sticky film of bacteria that forms on the teeth every single day. If not removed, this plaque hardens into tartar, a rough, yellow-brown deposit. This tartar irritates the gums, causing inflammation known as gingivitis. This is the earliest and only reversible stage of dental disease. Left untreated, gingivitis progresses to periodontitis. This is where the real damage happens. The inflammation goes deeper, destroying the tissues and bone that support the teeth. This process is not only painful but can lead to loose teeth, tooth loss, and even severe infections like a tooth root abscess, which is a pocket of pus that can form at the root of a tooth. While any dog can develop dental disease, some are at a much higher risk. Small and toy breeds, like Chihuahuas and Yorkshire Terriers, are particularly susceptible because their teeth are often crowded into a small mouth, creating perfect traps for food and bacteria. Brachycephalic, or short-nosed breeds like pugs and bulldogs, also face higher risks due to their jaw structure. And of course, the risk increases significantly with age, as plaque and tartar have had more time to accumulate. Dogs are masters at hiding pain, so the early signs can be incredibly subtle. You might notice your dog is suddenly picky about their food, preferring softer options over hard kibble. They might chew on only one side of their mouth or drop food while eating. Other subtle clues include drooling more than usual, shying away from you when you try to pet their head, or a new reluctance to play with their favorite chew toys. And that bad breath, or halitosis. It's a major red flag that bacteria are flourishing in their mouth. Here is your at-home checklist. Once a week, in good light, gently lift your dog's lips and look. Are the gums a healthy, uniform pink, or are they red, swollen, or bleeding, especially along the tooth line? Look at the teeth themselves. Do you see a yellow or brown crusty buildup, particularly on the back molars? Take note of any broken or missing teeth. And finally, pay attention to their behavior. Keep a simple log. Are they eating normally? Are they playing with toys? Is their breath getting progressively worse? These simple observations are invaluable for your veterinarian. When you bring your dog to the vet for a dental concern, the initial exam in the room is just a screening. To truly diagnose the extent of the disease, a comprehensive oral health assessment and treatment, or COHAT, is necessary. This is performed under general anesthesia. Anesthesia is crucial because it allows for a painless and thorough evaluation. Over 60% of the tooth is below the gum line, invisible to the naked eye. We use a dental probe to measure pockets around each tooth and take full-mouth dental x-rays to assess the health of the roots and the surrounding bone. This is the only way to identify abscesses, bone loss, and painful problems that would otherwise go completely undetected. Based on these findings, a treatment plan is made. This always includes a professional cleaning, where we use an ultrasonic scaler to remove all plaque and tartar from above and below the gum line, followed by polishing to smooth the tooth surface, making it harder for plaque to stick. Unfortunately, if periodontitis is advanced, some teeth may be too diseased to save and will need to be extracted. While this sounds scary, removing a painful, infected tooth provides immense relief for your dog. They adapt incredibly well, even with multiple extractions. After a professional cleaning, the focus shifts to prevention. The gold standard for at-home care is daily toothbrushing. Use a soft bristled brush and a toothpaste formulated for dogs. Never use human toothpaste. Start slowly, making it a positive experience with lots of praise. If brushing isn't feasible, there are other options. Look for products with the Veterinary Oral Health Council, or VOHC, seal of acceptance. This means the product has been proven to reduce plaque or tartar. These can include specific dental diets, chews, and water additives. While helpful, remember that these are supplementary to, not a replacement for, professional cleanings and brushing. The prognosis for managing dental disease is excellent. Once the source of infection and pain is removed, most dogs feel dramatically better within days. Improvement looks like a return to normal eating habits, renewed interest in toys, and an overall brighter, more energetic demeanor. You'll also notice their breath is significantly fresher. Regular professional cleanings, typically every 6 to 12 months depending on your dog's needs, combined with consistent at-home care, can halt the progression of the disease and maintain a healthy, comfortable mouth for life. So, when should you call your vet versus heading to the emergency room? Call your vet for a routine check if you notice persistent bad breath, visible tartar, or mild changes in chewing. However, you should seek immediate veterinary care, either at your vet or an ER, if you see facial swelling, especially under an eye, which can indicate a tooth root abscess. If your dog is actively refusing to eat or drink due to mouth pain, or if there is significant bleeding from the mouth. Finally, let's talk about cost. A comprehensive anesthetic dental procedure is an investment, Costs can range from several hundred to several $1,000s, depending on your location, the duration of the anesthesia, the number of X-rays needed, and whether extractions are required. While this can seem daunting, remember that you are not just paying for a cleaning. You are paying for a skilled team, safe anesthesia, advanced diagnostics, and a surgical procedure that eliminates a source of chronic pain and infection, protecting your dog's overall health and quality of life. Advanced dental disease can lead to bacteria entering the bloodstream, potentially affecting vital organs like the heart, kidneys, and liver. Investing in their oral health is investing in their systemic health. Diabetes. Early signs include thirst, urination, and weight changes. Monitor panting, appetite, and energy. Seek testing promptly. Cushing's disease. Gradual onset with subtle daily changes. Watch for potbelly, panting, hair loss, hunger, thirst. Addison's disease. Intermittent vomiting, lethargy, and collapse risk. Vet evaluation confirms Addison's. Treatment stabilizes electrolytes and improves energy. Next, heart disease overview. Number 6 on our list is heart disease, a condition that can quietly progress but has significant impacts on a dog's longevity and quality of life. Understanding what it is and what to look for is the first step in protecting your companion. Heart disease in dogs primarily falls into 2 categories. The most common is mitral valve myxomatous degeneration, or MMVD, where a valve in the heart becomes leaky. This is most prevalent in older, small breed dogs. The other is dilated cardiomyopathy, or DCM, where the heart muscle weakens and can't pump effectively, typically affecting large and giant breeds. The early signs can be subtle. You might notice a persistent, soft cough, especially at night or after your dog has been lying down. Fatigue and exercise intolerance are also key indicators. Perhaps they can't finish their usual walk or are reluctant to play. In more advanced stages, you might see an increased breathing rate, fainting spells, or a swollen abdomen. At home, you can monitor your dog's resting respiratory rate. Count their breaths per minute while they are sound asleep. A consistent rate over 35 is a red flag. Your veterinarian will start with a physical exam, listening for a heart murmur. Diagnosis is confirmed with chest X-rays to assess heart size and an echocardiogram, which is an ultrasound of the heart. This is the gold standard for identifying the specific disease and its severity. Treatment focuses on managing symptoms and slowing the disease's progression. Medications like pimobendan can improve the heart's pumping ability, while diuretics help clear fluid from the lungs. A prescription low-sodium diet is also often recommended. While there is no cure, early veterinary diagnosis and consistent management can significantly improve your dog's quality and length of life, often for many years. If you notice a sudden collapse, severe difficulty breathing, or a blue tinge to the gums, it's a medical emergency. Regular vet checkups, especially for at-risk breeds, are the best defense. Next, we turn to the liver, your dog's silent powerhouse. Liver disease refers to any condition that damages or impairs the function of this vital organ, which is responsible for everything from filtering toxins to aiding digestion and metabolism. Because the liver has a large reserve capacity, signs of trouble often don't appear until the damage is significant. While any dog can be affected, certain breeds like Bedlington Terriers, Dobermans, and Westies are genetically predisposed to specific liver conditions, often related to copper storage. Older dogs are also more susceptible to chronic liver changes. The most obvious signs often appear late in the disease process. At home, your checklist should include watching for any yellowing of the gums or the whites of the eyes, a sign called jaundice. Also, carefully log any vomiting, gradual but unexplained weight loss, a consistently poor appetite, and a noticeable increase in thirst or urination. Some dogs may also develop a swollen, fluid-filled abdomen. If you notice these signs, your veterinarian will start with a full physical exam and blood work. Key liver enzyme values like ALT and ALP can indicate liver cell damage, but they don't tell the whole story about function. For that, a bile acids test is often performed. An abdominal ultrasound is crucial to visualize the liver's size and texture, and in some cases, a biopsy is needed for a definitive diagnosis. Treatment is highly dependent on the underlying cause but almost always includes supportive care. This often involves a special prescription diet that is highly digestible and, if necessary, restricted in copper. Medications may be used to reduce inflammation, provide antioxidant support, and manage complications. The prognosis varies widely. Improvement often looks like a return to normal appetite, stable weight, and resolving jaundice. However, if your dog is extremely lethargic, collapses, or shows neurological signs like disorientation or seizures, this is an emergency requiring immediate veterinary attention. Liver problems often progress quietly, so consistent monitoring is your best defense. Autoimmune diseases. Immune system attacks healthy tissues. Watch gums, skin, joints. Early testing guides treatment. Splenic tumors can grow silently until bleeding occurs. Seek urgent care for weakness, pale gums, collapse episodes. Hemangiosarcoma. Sudden internal bleeding. Ultrasound and surgery options. Topping our list is the #1 cause of illness and death in older dogs, kidney disease. It's often called a silent killer, and for good reason. Dogs are masters at hiding illness, and their kidneys are so resilient that they can lose a staggering amount of function before any obvious symptoms appear. By the time you notice something is wrong, the disease may already be quite advanced. But by understanding the subtle signs, you can be your dog's best advocate and catch this disease early, dramatically improving their quality and length of life. So, what exactly is it? Your dog's kidneys are vital organs that act as a sophisticated filtration system. They remove waste products from the blood, regulate blood pressure, balance electrolytes, and stimulate red blood cell production. Chronic kidney disease, or CKD, is a progressive and irreversible deterioration of this function. While any dog can be affected, it's most common in seniors. Certain breeds like Samoyeds, Bull Terriers, and Cocker Spaniels also have a higher genetic predisposition. The earliest and most missed signs are increased thirst and urination. You might notice you're filling the water bowl more often, or your house-trained dog is suddenly having accidents. This happens because the damaged kidneys can no longer concentrate urine, so your dog drinks more to compensate and avoid dehydration. Other subtle clues include a gradual loss of appetite, unexplained weight loss, and lower energy levels. You might also notice a distinct, unpleasant chemical smell on their breath, often described as uremic breath, which is a sign of toxin buildup. If you notice these signs, it's time for a vet visit. Diagnosis starts with a physical exam and, crucially, blood and urine tests. Standard blood panels look at creatinine and BUN levels, but these often don't become elevated until about 75% of kidney function is already lost. That's why we now rely heavily on an earlier biomarker called SDMA, which can detect kidney disease when as little as 25% of function is lost, giving us a critical head start. Your vet will also perform a urinalysis to check for protein loss and measure your dog's blood pressure, as high blood pressure is a common and damaging complication. While there is no cure for chronic kidney disease, our goal is to slow its progression and maintain a good quality of life. This is where you, the owner, become the most important part of the treatment team. Management is centered around a multi-pronged approach. First is diet. Prescription renal diets are low in high-quality protein, restricted in phosphorus, and supplemented with omega-3 fatty acids to reduce the workload on the kidneys. Second, we focus on hydration. This may involve encouraging more water intake or even teaching you how to give subcutaneous fluids under the skin at home, which can make a world of difference. Medications also play a key role. We may use phosphorus binders to control phosphorus levels in the blood, medications to manage high blood pressure, and drugs to control nausea or stimulate appetite. Regular monitoring is non-negotiable. We'll need to recheck blood work, urine, and blood pressure every few months to track the disease's progression and adjust treatments accordingly. This is what we call staging the disease, often using the IRIS or International Renal Interest Society guidelines. Improvement isn't a cure, but a stabilization. Your dog's appetite returns, their weight is stable, and they are bright and engaged. That's our win. So, when should you worry? If your dog is suddenly unable to urinate, is extremely lethargic, is vomiting uncontrollably, or seems disoriented, that is an emergency. Go to the nearest veterinary ER immediately. For prevention, the best strategy is proactive wellness. Annual, And for seniors, biannual checkups with screening blood work can help us track trends and catch that subtle rise in SDMA long before your dog ever feels sick. Managing dental disease and preventing infections also protects the kidneys from damage. Kidney disease is a serious diagnosis, but it is not a hopeless one. With early detection and dedicated care, many dogs can live happily for months or even years. Prevention tips: wellness exams, labs, dental care, weight control. Rescue Spotlight. Exams catch hidden illnesses early. Adopted dogs need screening, vaccines, and parasite prevention. Every small check can change a life. Listen to your instincts. Schedule that appointment. Healthy days ahead start with early detection. Thank you for caring for your companion. Share this to help more dogs and families. Subscribe for more veterinarian-backed dog health guidance.